Today, we are witnessing a global-scale discovery. Medical students from Mid-20 at King Abdulaziz University in Jeddah have reached to significant information about the diseases of myelin. We're lucky to be the first to introduce their findings to the globe. Here are today's headlines. 1. The general patterns of post-infectious autoimmune reactions. And 2. The pathogenesis of CNS demyelinating diseases that occur after systematic infection.
Demyelinating diseases is a general term that we can define as any condition that results in damage to the protective covering or myelin sheath that surrounds nerve fibers in your brain, optic nerves, and spinal cord. Immune-mediated demyelination can happen as a result of a variety of systemic infectious diseases, including mild viral infections. These aren't known to be linked to the infectious agent's direct contact with the nervous system. However, immune cells responding to the pathogen-associated antigens are thought to cross-react with myelin antigens, leading to the myelin destruction. When the myelin responsible for the insulation of axons is damaged, this results in poor conduction of action potentials, impaired neural signaling, and, in some cases, partial or complete neural loss. There are two general patterns of post-infectious autoimmune reactions to myelin. Unlike MS, multiple sclerosis, which is the most common demyelinating disease, these patterns are associated with acute onset or monophasic. First, we have acute disseminated encephalomyelitis. This pattern affects the white matter of the brain and spinal cord. Symptoms typically develop 1 or 2 weeks after a previous infection and are non-localizing, such as headache, lethargy, and coma. Symptoms progress rapidly, and the illness is fatal in as many as 20% of cases. But in the remaining patients, there is complete recovery. The second pattern is acute necrotizing hemorrhagic encephalomyelitis, lesions in the brain that develop edema and necrosis when the condition progresses. It's a rare central nervous system complication, secondary to influenza or other viral infections. The most common clinical presentations are fever, rapid alteration in the level of consciousness, and seizures. It's a more devastating related disorder, which typically affects young adults and children. Now, after we discuss the patterns, let's take a look to some acquired diseases of myelin. We'll talk about 3 of them: neuromyelitis optica, central protein myelinolysis, progressive multifocal leukoencephalopathy. Neuromyelitis optica, or NMO, is an antibody-mediated demyelinating disease centered on the optic nerves and spinal cord. There are 2 types of NMO: the relapsing form, which has periodic flare-ups with some recovery in between. This is the more common type. And the monophasic form, which involves a single attack that lasts a month or 2. Here in Figure 1, you will see an MRI of a 10-year-old girl that has been diagnosed with neuromyelitis optica. Central pontine myelinolysis. This disease mainly affects the brainstem, but other areas of the brain can also be involved. The most common cause is a quick change in the body's sodium level. This must often occur when someone's being treated for low blood sodium, as in hyponatremia, and the sodium is replaced too fast. Sometimes it occurs when a high level of sodium in the body, as in hypernatremia, is corrected too quickly. That may result in a rapidly evolving quadriplegia. In Figure 3, MRI has been done on the 35-year-old man, and he got diagnosed with central pontine myelinolysis. The last disease is progressive multifocal leukoencephalopathy, or PML, a demyelinating disease that occurs after reactivation of the John Cunningham virus in people with a weakened immune system. They are the most likely to get this disorder. People may become clumsy, have trouble speaking, and become partially blind, and the mental function declines rapidly. In Figures 4 and 5, 2 patients that have been diagnosed with PML using MRI. Thank you very much for listening to this report. If you are interested and want to learn some more about the diseases of myelin, please scan the barcode to see more resources. My sincere appreciation to my colleagues and our supervisor for supporting this project. Hoping to see you in future discoveries. Back to the studio.